Hello and welcome to the weekly blog. My name is Dr. David Hutchings, and as always, these are being sponsored by SpectrumMed. A couple things I wanted to mention first before we jump into our blog this week is that the NARA lecture that we did last week had great reviews. We're very, very excited. A wonderful turnout for that presentation on the impacts of COVID on Alzheimer's and dementia patients and caregiving. As I mentioned before, that's a two-part series. So the second part will be in June, and once I have that date, I will let everybody know. Also, we have been invited to be a part of the National Alzheimer's Association Symposium, in which I'll be doing two different sessions for those guys. One on dementia, understanding Alzheimer's and dementia, and we'll go into the genetic aspects of that as well, prevention, symptom management. And then the second session that we're doing will be talking about, again, the impacts that we've had on the COVID-19 pandemic has had on our dementia and Alzheimer's patients and caregivers. So once we have dates for all those, I'll make sure I get those out to everybody in the next blog. So one of the questions that we had that's come through a couple times, and it was really interesting because one of the lab sessions that we did the other day had this lady who's a mother to one of her child who has some type of impairment. I'm not sure what the diagnosis was. And she was actually being trained on using the Guardian protocol in her home with her own child. And I thought to myself, I was like, this is absolutely fantastic. And we have done this with many patients, and it allows us to have not only a continuum of care. So if whether it's, let's just say geriatrics, they go hospital, they go and then they go move into that post-acute outpatient, and after that, we're always subject to the insurances, right? So after that, when we know the patient needs more and they're not able to get more because of the insurance and the frequency restrictions, then we can actually train that family, whether it's adult or pediatric, on how to use the device, how to reach a motor point, the electrode placements, and actually continue to treat that swallowing disorder in the home setting. So I want to talk about that because we actually have another patient that we're treating in England right now, which is amazing. A mother and father doing the same thing with their little kiddo. And of course, it's something that we're recommending for a lot of patients. From the dementia side of things, as everybody knows, that's kind of my obviously my specialization. This is something that, as I see patients in the community, that I recommend as well. And I have another patient right now that has Parkinson's who's going to be doing the same exact thing. So definitely, as you work using this protocol, we know it works. We have the outcomes, and once we get through that care continuum post-acute, then we can actually train the families to be able to do this in their own home with their own family member, which gets that continuum of care, and we can continue the treatment protocol along a long period of time. So keep that in mind. If you want more information on that, please give me a shout, and keep the questions coming, keep the emails coming, because it's obviously what helps us drive our blogs. Until then, I will see you again next week. Thank you.